Hello, can everybody hear me okay? Oh, you're muted, okay. I'm going to proceed and introduce myself. My name is Jessica Somerville. I'm a doctor of physical therapy at the Recovery Project. And today I'm doing a presentation on the impact of MS on the function of bowel and bladder. And my cheesy catchphrase is, "You are not alone." Before I get started, I just want to preface it by saying we are recording this so that we can put it on our YouTube page and people can access it whenever they want to. I also know that there may be some questions at the end. So at the end of this, I will stop the recording since this is a sensitive subject and people may be asking more personal questions, so that your name, your questions, or your face won't be recorded on this. All right. Oh, let me make sure there's a few more people that logged on. So I'm going to admit all of them. Okay, it looks like everybody is on. So for those that missed my spiel, I'm just going to repeat it very briefly. My name is Jessica Somerville. I'm a doctor of physical therapy at the Recovery Project. I specialize in pelvic floor as well as neurological rehabilitation. This is recorded, so for any questions at the end, I will stop the recording so that you can ask them and have your privacy protected. All right. So first of all, MS Awareness Week. Thank you for joining us. We're really excited to be offering free wellness classes and then some additional support and education around some of the symptoms that impact people with MS. I specifically today will be talking about the impact that MS has on your bowel and bladder. And the catchphrase is, "You are not alone," because 80% of people with MS experience change in their bladder function. This is an incredibly huge number. Here at the Recovery Project, we work with a lot of people that have MS, and this is rarely something that comes up a lot during our interventions and discussions. That's one of the reasons why I have become really passionate about spreading education and awareness about this, because if it's affecting 80% of the clients that I see day to day, and we're not doing anything to help it, I think that we're doing a little bit of a disservice. I have found some amazing resources on the MS Society website. I'm going to read a list of questions just to get this presentation started. And if you're thinking that you or someone that you know is affected by any of these, then you may benefit from either therapy or medical interventions that regard bowel and bladder. So list of questions, again, courtesy of the MS Society. Am I finding it more difficult to start urinating when I get to the toilet? Do I feel as though my bladder isn't completely emptying when I finished urinating? Do I experience frequent or recurrent urinary tract infections? Am I using pads or any other strategies to protect my clothing from leakage? Am I limiting the amount of fluids I drink or changing what I eat because I worry that I will have to urinate frequently? Am I planning my daily activities around my bladder symptoms? And do my bladder symptoms keep me from doing what I want to enjoy? And if I had to spend the rest of my life with my bladder behaving the way that it is now, would I be unhappy? If you answered any of these questions where yes, you may be experiencing bladder symptoms. In the same way that lesions with MS can interfere with the messages your brain sends to your muscle, it can also send faulty messages or no messages at all to the systems that control your bowel and bladder. Many people living with MS experience frequent urination, leaking, difficulty emptying the bladder, constipation, diarrhea, or loss of control of their bowels. I'd like to speak about the common symptoms, causes, and options for treatment for bowel and bladder dysfunction, and hopes to share information that can change or improve one's quality of life. As you know, if you have experienced any of these changes, it is a major quality of life. It can really impact your confidence, and it can change how you participate with your family or engage with your community. The rest of this mini presentation is going to cover a brief overview of the role of the pelvic floor, some tips and strategies with dealing with bowel and bladder issues, and then treatment options, whether it's rehabilitation, lifestyle changes, or medical interventions. So first, I'd like to go over what is the pelvic floor and how does it work. So if you have men and women have a pelvic floor, I like to say that right off the bat because that is not something that is very clear. The pelvic floor really functions as a group of muscles that coordinates with your organs. We have the 5 S's: support, stability, sphincteric. It's a sump pump, meaning that that's where a lot of our lymph nodes are located. And it also helps support our sexual health. It's something that we take for granted until it stops functioning the way that we want it to. And then it can majorly impact our quality of life and our ability to maintain continence, sexual function, and then regulate some of our fluids. It's a complex system that depends on our bodies being able to sense the pressure in our bladder and bowels as we build up in fluid or solids. What happens then is your brain gets a message down from your bladder up to your brain, and your brain gets to make that decision. Is it time to go? Is it not time to go? You need to have the adequate strength once you make that decision to hold it if you're not in an appropriate area to go to the bathroom. And that's when you have the voluntary contraction to close down your sphincters and say, nope, we have to wait until we can make it to the bathroom. Our gross motor strength is also important. Can I walk to the bathroom in a way that allows me to hold my bladder, get there on time, remove my clothing with the dexterity in my fingers, and then safely sit down on the toilet to avoid my bowel or my bladder? And then once we're there, your brain sends a message to your bladder. You have a thin layer of muscle over your bladder that gets to contract while your pelvic floor relaxes and you void your bowel or bladder. In a perfect world, it's a great system. But all of this is controlled by messages that come from your organs up to your brain and from your brain down to your organs. With MS, lesions can affect any of these messages going top to bottom or bottom to top. And depending on the type of incontinence you have, it can either be strengthening, relaxing the muscles, spasticity can impact this, a variety of lifestyle changes, mobility, or a lot of times it can be medically managed with medication or surgery. Okay, so I'm going to cover some information on the bladder first, and then we'll go over some of the bowel function. So with people living with MS, they may experience interruptions in the messages either sent from their brain or missed sensations coming up from their bowel or bladder, secondary to the lesions in the central nervous system. In terms of incontinence, this can look like leakage, partial emptying of the bladder, difficulty releasing the urine. So when you sit down, you feel that urgency, like you have to urinate and you can't, or it's just a little bit. And inability to empty the full bladder when you're in the bathroom. Again, this can come from weakness, spasticity, poor coordination of your pelvic floor muscles. So treatment options, I'll start with one that I'm the most familiar with, which is physical therapy. There are devices in the same way that people can have electrical stimulation to their muscles. You can do electrical stimulation to your pelvic floor muscles to help coordinate them, strengthen them, and get them to function in a way that is useful for maintaining continence. Biofeedback, again, it's these little sensors that can go on your pelvic floor. When you perform a contraction, you're able to see that those muscles are contracting if you are unable to feel or sense when they are contracting instead. You can strengthen your pelvic floor if it is more of a weakness issue, lifestyle modifications, and then having a home exercise program. So lifestyle modifications, that's something that is I wouldn't say an easy fix, but just some quick information to change the way you're consuming bladder irritants. So bladder irritants include anything acidic. So that would be tomatoes, lemon, carbonated beverages, whether or not it has caffeine in it, coffee, tea, alcohol. I kind of feel like I'm naming all the good stuff. Chocolate and spicy foods can also contribute to increased frequency of urination. If you have a list of these foods and you love them, it doesn't mean that you have to give them up. It just gives you some information on when to be mindful about eating them. If you're going to be out and about, away from a restroom, avoid that cup of coffee, skip the tomato sauce. Many people, that bubble water is really, really popular these days. And I think that there is a misunderstanding that that is not a bladder irritant because it doesn't have caffeine in it. But that, again, can increase your need to urinate frequently. A lot of people will dehydrate themselves throughout the day if frequent urination has become an issue for them. And I really caution against that. What I say instead is, dose your liquids at a time where you can be near a restroom. So 2 hours before bed, if you're getting up in the middle of the night and peeing a lot, I would start restricting your liquids. But restricting them throughout the course of the day can lead to increased risk of urinary tract infections and constipation. So keep that in mind if you happen to be restricting a lot of liquids because of frequent urination. If you have tried all of the conservative methods, physical therapy, lifestyle modifications, and it's still impacting your quality of life, self-catheterization for fully emptying on a schedule can be really, really helpful to improving one's quality of life. And what that helps is you get to choose when you go to the bathroom instead of urinating a little bit at a time, where some people have difficulty voiding their full bladder. You can control that you empty your full bladder at scheduled intervals, so you're in control of when you're using the restroom. I still have people in the weight room. Oh, I still have people in the weight room. Okay, excuse me. I'm going to admit some more people. Okay. A couple more people. Hi, welcome. I am getting into bowel management at this point. And again, hold your questions to the end, and then I'm happy to answer any of them. Okay, so symptoms of bowel dysfunction with MS would be constipation, diarrhea, or loss of control. So similar to bladder, what do we need to maintain our regularity and control with bowels? We have to sense that we have to have the sensation that our bowels are filling up. We have to have the control and strength. Oh, sorry, just not TJ. My tech support's helping me out here. And we have to have the mobility to get from where you're sitting or in your bed to the toilet. Causes for having abnormalities with bowel is not just related to the lesions with MS. It can also be a cause of decreased mobility, dehydration. I mentioned that with people restricting their fluids. Diet or medication. A lot of medications, particularly pain medication, can contribute to constipation. And I'm going to have a side note on that. Again, MS Society has this wonderful page with lists of medications that contribute to constipation. And then changes in signal from the brain secondary to MS lesions can either cause loss of control or poor sensation with maintaining continence in your bowels. Okay, so tips to promote some quality of life. Drinking 6 to 8 glasses of water a day can be really helpful in helping maintain regularity with bowel movements. Now, this relates more to constipation. For those that are unfamiliar with how the bowels work, the longer your stool sits in your intestines, the drier it becomes and the harder it is to pass. So dehydration, again, dries it out. It's harder to move your bowels when you have more of a hardened blockage. Okay, so planning your pit stops too. Our bodies like to have a schedule. So first thing in the morning, after a cup of coffee, both for bowel and bladder, we can train our bodies to go at scheduled intervals. It takes time. It can take almost 4 to 6 weeks to get on those schedules, but once you do that, it really improves your quality of life. If mobility is one of the barriers to remaining continence, try to wear clothing that's easy to remove. So elastic waistbands, avoiding buttons if you're lacking dexterity, and then darker colored clothing can also avoid any embarrassment if you're out in public and you do happen to have a leakage. If you're out and about and you're not sure when you're going to be able to use the restroom, or it's going to be quite a while before you go home, carry a change of clothing and bring some wipes with you. That way, if there is a leakage or an accident, you have the ability to clean up and carry on with your day versus coming back home and missing out on what other doctor's appointment, social engagement, family outing that you have planned. This one's my favorite, keeping moving. Exercise and mobility help aids in digestion and helps avoid constipation. Speak with your doctor about fiber intake. What we eat can greatly improve our bowel movements and our regularity with going to the bathroom. So speak with your doctor, or maybe have a visit with a nutritionist, including fruits and vegetables and whole grains in your diet, is a great way to start. Setting up a routine for a daily schedule of voiding, and then speak to your healthcare professional about stool softeners, bulking agents, manual techniques. There's an abdominal massage if you're suffering from constipation, or suppositories. Continuous use of laxatives is not recommended, but keep in mind that sometimes these are prescribed by doctors, but if this is a long-term thing, they tend to stop working and then they become less effective for you. These techniques that I described can take weeks to take hold, but they can really change your quality of life. Multiple sclerosis, or the MS Society, is a wonderful resource. They have a whole section on bowel and bladder, on different medical interventions, therapies, advice on management, as well as that list of medications that either helps with urinary frequency or can contribute to constipation. If you are having any difficulty with this, bring a list of questions to your next doctor's appointment, and they can direct you to the right provider, whether it's a urologist or a physical therapist, to see if you can help get some interventions on this. And I am going to stop the recording now and leave some time for questions. But thank you for listening to me. And I hope that this was helpful and kind of a brief overview of bowel and bladder and how it can be impacted by MS.